Good morning. My name is Patricia Lair. I'm a registered dietitian and long-term care surveyor with the Alabama Department of Public Health. And today I'm just going to give you a brief overview of nutrition and pressure ulcer treatment and prevention. This presentation is focused on adult nutrition needs, including hydration, to avoid or treat pressure ulcers. The nutrition screening, assessment, care planning, implementation, monitoring, and evaluation process can be applied in other nutrition-related situations. Nutrition screening is the preliminary step used to identify individuals at nutritional risk or with a nutrition-related problem. It can be completed by any qualified member of the healthcare team. And this is done to determine if further assessment is needed, a more comprehensive nutrition assessment. All residents are screened for nutritional risk upon admission to a healthcare setting. Individuals at risk for pressure ulcers or with a pressure ulcer should definitely be screened. And they should also be screened with each significant change of clinical condition. Also, when progress toward healing of a pressure ulcer does not occur. Nutritional screening tools should be valid and reliable. The RAI, the Resident Assessment Instrument used by CMS, is a tool used to identify resident care problems, and it does have nutrition components. But specific screens for nutrition are often used in the healthcare setting. Anyone determined to be at risk for malnutrition and those with an existing pressure ulcer should be referred to a registered dietitian or to an interprofessional or interdisciplinary nutrition team for a comprehensive nutrition assessment. Now, the nutrition assessment is usually done by the registered dietitian. It is a nutritional focused assessment which looks at the individual's intake, their height, their weight, their body mass, waist circumference, also whether they're sedentary or active, if there are any psychosocial influences to be considered, and also specifically they look at the medical history, lab results, medical procedures, diagnoses, etc. Individuals' weight status should be assessed to determine weight history, in other words, their usual body weight, and to identify any significant weight loss. Significant weight loss is defined as equal or greater to 5% weight loss in 30 days, or greater or equal to 7.5% weight loss in 90 days, or equal or greater to 10% weight loss from their usual body weight in 180 days or 6 months. Most long-term care facilities will weigh an individual upon admission or readmission to establish a baseline weight, and then that person will be weighed weekly for the first 4 weeks after admission and at least monthly thereafter to identify any trends or insidious weight loss. And of course, to gather an accurate weight is important. You want to use regularly calibrated scales. The resident should be weighed in similar clothing at the same time of day, and weighing the resident on the same scale instead of going from one scale in the facility to another. If they're going to use a bed scale, they should consistently use a bed scale, or if they're using a chair scale, the same thing. Also, the individual's ability to eat independently should be assessed. Do they have any cognitive or physical issues where they are not able to feed themselves? Are they able to use adaptive feeding devices? Do they have problems with swallowing? Is there any need to assist them with eating and drinking? Are they on tube feeding? The adequacy of the total nutrient intake should be assessed. Food, fluid, oral supplements, if they're on an enteral feeding, what is that total intake? In other words, the individual's actual intake should be assessed to determine if they are consuming sufficient food and fluid to meet their needs. In addition, the ordered diet should be looked at to determine if it actually meets the individual's estimated nutritional needs. An assessment should determine the individual's requirements for calories, also referred to as kilocalories, which refers to energy, protein, fluid, but are they hydrated? One method of determining caloric need is to use the Harris-Benedict equation to determine the individual's basal energy requirement. And you should have a form available to you where you can use this equation. Now, there are other equations that can be used, but this is one we've been using. Then you add factors for activity and injury. Activity can range from comatose state to constant motion. It could mean walking with a walker. It could be a different factor for walking unassisted. Injury can refer to surgeries, infection, pressure sores, and there are factor levels for each of these. The Harris-Benedict equation, or BEE, which stands for basal energy expenditure, are different for males and females. The top equation is for a male. BEE equals 66 plus, then you have a calculation that has to be done before, which is based on weight in pounds, and then height in inches, and then age in years. And that will give you the total kilocalories needed just for that person on a baseline level. Same thing for the female. Then the nutritional assessment, you're going to also look at the total daily expenditure, TDE, and you estimate it by calculating in the activity factor and the injury factor, using the BEE times the activity factor times the injury factor will equal the total calories required. Activity factor for a bedfast person would be 1.2. If they were ambulating alone, it would be 1.35. If they're able to do light tasks and are doing them, it would be like 1.4. Injury factors, like for minor surgery, would be 1.1. For a severe infection, could be anywhere between 1.3 to 1.5. And that's really, the factors are not absolute. They're going to be based on the individual's clinical condition and the professional judgment of the dietitian making the estimation. Okay. Wound healing would be anywhere between 1.0 to 1.6. Then you'd look at the protein requirements to get an estimated amount per day. It can be calculated by the weight in kilograms times the protein factor. Now, weight in kilograms, of course, you're going to take, that's going to be weight in pounds divided by 2.2 to get the weight in kilograms. The protein factor could include anything from like no trauma, 0.8 to 1.0, or if you had something like a stage 2 pressure ulcer or one fracture, either or, your protein factor would be 1.2. Nutritional assessment for fluid, those can be calculated by, again, using the weight in kilograms times the fluid factor to equal the cc's required per day. The fluid factor can include like 25 cc's per kilogram body weight if the person has congestive heart failure, 30 cc's per kilogram body weight for a normal individual, and 40 cc's kilograms per body weight for someone with fever or UTI. Using the nutritional assessment the registered dietitian, in consultation with the interprofessional team or interdisciplinary team, should develop a care plan and document an individualized nutrition intervention plan based on the nutritional needs, the feeding route, and the goals of care for that individual. If a person has a pressure ulcer or who is at risk for pressure ulcer, they should be expected to have an individualized nutrition care plan. And of course, in care planning, you're going to have measurable goals. There should be responsibility assigned for the implementation of the care plan. There should be a method for monitoring the adherence to the care plan and how effective it is. And if it's determined that the care plan is not working or is not producing the desired result, it should be reevaluated and new approaches should be attempted with documentation from the registered dietitian. In fact, you should really expect monthly documentation from the dietitian once the care plan is put into effect. Evidence-based guidelines on nutrition and hydration for individuals who exhibit nutritional risk or who are at risk of pressure ulcers or who have an existing pressure ulcer are as follows per the National Pressure Ulcer Advisory Panel. These recommendations include energy intake. They recommend providing 30 to 35 kilocalories per kilogram of body weight per day for any adult at risk of a pressure ulcer who's also at risk of malnutrition. The same amount would be given to an adult with a pressure ulcer who's assessed as being at risk of malnutrition. Protein recommendations include providing adequate protein for positive nitrogen balance for adults assessed at risk of a pressure ulcer or for adults with a pressure ulcer. They recommend offering 1.25 to 1.5 grams protein per kilogram body weight. That's when it's compatible with care goals. Depends upon their renal function. For adults at risk of a pressure ulcer who are assessed at being at risk of malnutrition, and for adults with an existing pressure ulcer who are assessed at being at risk for malnutrition. When dealing with adding protein, you want to assess the renal function to ensure that the high levels of protein are appropriate for that person. If a person has a stage 3 or a stage 4 pressure ulcer, or if they have multiple pressure ulcers, they often are supplemented with high protein, arginine, and micronutrients. Those things are offered when you cannot meet their nutritional requirements with a traditional high-calorie and protein supplement. Hydration is provided and encouraged for daily adequate consumption for an individual at risk of or with a pressure ulcer, an actual pressure ulcer. You want to provide additional fluid for individuals with dehydration, fever, vomiting, diarrhea, or heavily exuding wounds. Individuals, of course, have to be monitored for signs and symptoms of dehydration, including changes in weight, skin turgor, urine output, evaluated serum sodium, and or calculated serum osmolality. These are all recommendations that you would expect to be considered in the care plan for an individual with a pressure ulcer or at risk of pressure ulcers. However, you would need to interview the dietitian or members of the interdisciplinary nutrition team to determine how these things were considered for each individual, as each individual has different clinical needs. Thank you for attending.